So I'm just going to share my slides. Hopefully you can see those slides. And again, welcome to the UCL MBA Health Open Day. It's a real pleasure to be here and to be able to present to you. As I said, I'm Professor Nora Colton, and I'm the director of the Global Business School for Health, and I'll be presenting today. First of all, before I talk about our MBA, I'd like to just talk a little more about the school so that you understand just how unique and what an incredible experience this school is. We are the first business school in the world totally dedicated to educating health professionals in healthcare management and leadership. This school is really, about combining business and health and that real intersection. And we are really at a very unique time in history where health and healthcare have never been more important. And of course, with the pandemic, it's very much on everyone's mind. But often what we find with business schools is that health is not a big part of their curriculum and teaching. And likewise, we often find in health faculties that an understanding of business in that business space in which healthcare sits as a sector is not always taught really well. So what we do at the Global Business School of Health is we really bring those two together in a very exciting and interesting way. Many of you might know that healthcare and health as a percentage of GDP across the world is up around 10%, 20% in some countries. And that is because of multiple reasons. One is in many countries, historically, they haven't invested enough in their healthcare systems. And now they realize as populations need more healthcare, there's a call for access, there's a call for better quality. They need to make improvements. And those improvements are very much on leaders' minds. So we have what we call the catch-up effect, where countries around the world are investing more into their healthcare sectors. But all those investments, they have to really be smart investments. They have to recognize the need for change, technology. And those are also very important topics that we teach in business schools. So it's really understanding that space, how it's evolving, how we need to change healthcare and health, perspectives. We need to think more about not just therapeutics, but we have to think about diagnostics. We have to think more about prevention than ever before. We also have to think about our workforce. We see in places like the United States, what they call the Great Resignation, where people are leaving their job, particularly in this kind of post-pandemic period. And what is couched in that is over 500,000 health professionals, people who are clinicians, moving out of healthcare. So you already have a sector that's very much in need of a bigger, better workforce, and yet people are leaving it because they're often, burnt out. They're feeling inadequate in trying to address all the health need, both in terms of not just the pandemic, but non-communicable diseases, which affects everyone across the world, aging populations, and other related changes such as climate change. So that's what really this school is about. It is about helping to carve out a place where healthcare management is front and center, where we work with practitioners and industry to really make a difference for healthcare. So nothing's more important than an MBA, because an MBA is really an essential kind of critical skill that you get. And it's that holistic approach of kind of general management skills at a very pivotal and important time in people's careers that they often come to do an MBA. But why a UCL MBA in health and not a general MBA? Well, as I've just mentioned to you, the health sector is becoming more important on a daily basis. As you can see from this quote from the former dean of the Harvard Business School, medicine and business have long been intertwined, but today, with the extraordinary promise of emerging medical technologies, sweeping change in delivery of healthcare, and the push to control the cost of medication, the need for leaders firmly grounded in both fields has never been greater. So that really is what this UCL MBA Health is really about. It is about creating an MBA that brings in lots of relevant cross-disciplinary approaches for health professionals, medical professionals, people who work in related sectors such as technology, pharmaceuticals, biotechnology, because there's so many changing needs for leaders and essentially pivoting your career and taking your career into this exciting space. So, the other thing is, I often get asked by students, why would I do an MBA and not just an MSc? Well, I'm going to tell you, they're very different experiences. The MBA is really a very holistic experience. It'll open up not just specific career opportunities, but it really will open up your mind. It will take you through what most of us have had to get from years of experience of working in a much more truncated time. So it accelerates your career. And that's one of the reasons why often we hear MBA salaries are very high. It's because when you take an MBA, the way you'll be taught, and I'll talk more in just a minute about how this MBA Health is taught, but it is about creating a confident decision maker, somebody who can really deal with ambiguous situations, who understands what leadership really is and how to apply it in practice. And all of that will come through the way in which you'll be instructed and the way in which you'll do case studies and you'll look at different topics and how your instructors will be challenging you throughout to really think, to grow, to develop. Alongside that, the MBA offers you a lot of personal development. So it really shifts your mindset away from just thinking about you and your contribution and really into a much more managerial leadership frame of mind. I often have met people who've stepped up within their organization, and they'll often say to me, I started to think about things I'd never thought about before now that I'm a manager. Well, of course, because you take on responsibilities. It's no longer just about you. It's no longer about yourself. It's about your team. And then it's about your organization. So that's really what doing an MBA is about. It's about really taking you to the next level in a much more methodical yet accelerated pace. So it's really what I'd call a boot camp. You will come in this MBA, you'll have sprints. And again, I'll talk about how the program's timed and how it works across the academic year. But it's really about getting those technical skills alongside the soft skills that you need to be an effective leader and manager. So when should you do an MBA? Most people do it early on in their career, particularly an MBA that I'm talking to you about today, which is mainly face-to-face. Or they'll do it mid-career when they're thinking about rebooting, changing careers. Maybe that's where you are as well. Or it's just about accelerating your career, and that can happen at any point. UCL is really the right place for you to do this MBA Health? Absolutely. We're not only rated 8th in the world, but this faculty of population health, where our School of Global Business School for Health sits, along with our UCL MBA Health, is rated 5th in the world. UCL is also #1 in research in the UK. And most of what happens at UCL is around health, medical, and life sciences. So we really are the right university for pursuing such a degree. And we will leverage that throughout our program. You'll have speakers coming in as guest speakers throughout the university, as well as practitioners, industry, really coming in to support you in your experience. So what makes us really then stand out is, well, as I said, health isn't an afterthought at UCL, and it's surely not an afterthought in the Global Business School for Health or this UCL MBA for Health. It's front and center. We really understand the health sector. You know, UCL has got 5 NHS trusts associated with it. We have really put in lots of opportunities within these programs for you to actually meet the leaders, the change makers, the influencers, the thought leaders in health and healthcare management. We all have a really unique program called our Health Executives in Residence program, where you'll have CEOs, former CEOs, senior leaders who will be available to mentor you, set up office hours where you can meet them. They'll also be able to give you career advice, talk to you about opportunities. We'll have a number of networking events across the year. We'll be also working with a recruitment agency to help offer you an evaluation at the beginning. We want you to visualize what you want. You know, students ask me sometimes about jobs. Well, your career starts on day 1 with us. We will be looking to help you visualize, understand where you want to get and, and where you want to go out of this program, and help you to deliver on your expectations as we go through. We also have an incredible alumni network at UCL. People who are really proud to have gone to UCL. UCL has been a real change in their life. So you'll have opportunities to meet some of those alumni and network with them. And of course, your classmates. I mean, that's one of the most exciting things about doing an MBA. And I can already tell you that this MBA will have people from all over the world. It will have people who come from to the health kind of sector from different angles, both in terms of consultants, people who are working in public health, people who are working in pharma. So it's a real opportunity for you to network with some incredible people where you share that passion for health, healthcare, and moreover patients and making a change. So typically, who do we anticipate coming onto this program? Well, as I said, people who are either early or mid-career, who have, had good academic experiences or clinical background or work experience. Most importantly, though, people who are ambitious and determined to really make a difference in this space, those change makers that I just mentioned. And many of them will be looking to build careers in, healthcare management, pharma, biotech, consultancy. Some are just looking to really accelerate their career in the area that they're already working in. But everybody will be looking to really gain those networks of international healthcare peers and collaborating with industry, getting that kind of career advice, moving themselves forward in some very interesting ways. And that's really what makes this such an exceptional MBA. So where can you anticipate working when you finish this MBA? Well, there's lots of different career outcomes, and a lot of that will depend upon you, your drive, your interest. We see last year there was an article published in the US. It said that actually in general MBA programs, health and healthcare organizations, firms, and people looking for people with health backgrounds is now the 3rd to 4th most important sector. So you can imagine then just the opportunity here. Some of you will want to go into health consultancy. You might want to work for one of the big 4 consultancy firms, senior management roles, again, pharma, biotech, public, private healthcare spaces, the NHS, BUPA, the World Health Organization. Some of you might want to become analysts, medical directors, work in legislation and policy sphere. And then others of you may want to go into health tech, med tech. All of that is really available, and we will be working with you to really make sure that your experiences on the program help you really, launch and move into those areas. And we'll be giving you maximum exposure to lots of people from different backgrounds, as mentioned here, so that you can see what those opportunities really look like. So it's a fantastic program. And, it is a 12-month program if you do it full time. And I will talk in just a minute about how it's delivered. If you do it part-time, and it is available as part-time, and I'll talk to you just in a minute also about how that works, you can do it over 24 months. It starts in September, and it starts with really, 2-week induction, which includes a 3-day residential. So we'll take you and all your colleagues and the MBA team off campus for 3 days to really build your teamwork skills, get to know each other, do a lot of self-reflection, think about your own personal journey, your attributes as a leader, how you want to be shaping yourself through your MBA. And even before that, by the way, we'll be asking you to complete some online primer courses. So, often students say to me, I'm a little worried about the finance. That's okay. We will make sure that you're ready. We want to make sure that everyone comes in, thinking and understanding where they need to go. We also have a fantastic module that we ask all the students who come to the Global Business School for Health. It's an online module, and it's on health systems. And it's a great opportunity to learn about other health systems in other countries across the world, so that when you meet your colleagues, you understand where they're coming from and understand the nature and evolution of health systems and the kind of context. So now what I'd like to do is just take a moment and talk specifically about the program and the program structure. It's really important to understand that. So as I said, you can visualize yourself. You're going to do these online modules, kind of get yourself ready, a few months before you arrive. You'll start out in the program. You'll have a 3-day residential where you'll go away and really have an opportunity to self-reflect and to meet your colleagues. Then you'll also start into your first core module. So the modules, the way they're designed is they're quite chunky and they're delivered in blocks. So you will get access to the first module. The first module is called Strategy, People, and Marketing. You will have access to our area learning network, and we use something called Moodle. On that site, you'll have videos that you can look at. You'll have some business cases that you'll read through, some other readings that you'll do. All of this will be preparing for this block. The block will start right at the beginning of the academic year. You'll have a very intense week learning about strategy, one about learning about people, which is human resource management and organizational behavior. And then you'll have a week on marketing. And then you have a 4th week, and it's a really important week. It's called wrap-up week. And that's where your module convener will pull all that learning together so you can see it in a coherent way, and also have a number of health professionals who will come in and really bring it alive, talking about their roles, how they work within that broader healthcare system in these areas. And so you will also have your assessments that you'll do. And then you'll have 2 weeks where you'll prepare for the next block, which again will be 4 weeks. You'll do, again, readings, you'll interact with videos, you'll have discussion questions, and then you'll come in for 4 weeks. You'll have a week of accounting and financial reporting, a week of corporate finance, and a week of policies and practices in healthcare and health, and then you'll have a wrap-up week again. And that's really your term 1 if you're doing the program full-time. And then you will also, along the way, throughout those 10 weeks, you will have some workshops. They will be very much focused on your Global Health Challenge project, which I'll talk to you in just a minute about. And then in term 2, you'll also have 2 more modules that you'll have to complete. And again, they have these different themes in them. So you're covering quite a bit. These are really jumbo modules, as I said. So the first one you'll take in term 2 is called data-driven management. So you'll have a week of economics and health economics. And again, you will have prepared ahead of time for that. You'll have data analytics, and then you'll have sustainability in healthcare in your wrap-up week. And then your 4th and final block is really exciting. It's contemporary topics in health and healthcare. So every year we'll be evaluating whether or not the topics that we've taught are relevant. They are the key themes. So you might have a week of systems thinking, health systems thinking, data analytics, innovation, something again on looking at leadership and change management. So these topics will be changing depending on what are really the priorities. So the way we teach is very much using case studies and real world scenarios and bringing in practitioners alongside academics. We want you to really understand this space and how to contextualize and how to use what you're learning. And that goes back to what I said at the beginning, that it's through those decision makings, looking at cases, doing problems, that you will gain that confidence. So you'll be presenting quite a bit when you're in class as well, so that you can become that confident decision maker. Now, I just wanted to take a little more time and talk about these projects because they really are your capstone projects. But this one, the Global Health Challenge, really starts at the beginning of your program. You'll be put in a group with your colleagues. You'll work on a project in a lower middle income country. You'll have a 2 weeks immersion field experience. And the project will culminate with really a group research paper and presentation that you'll finish up at in term 3. So it really runs across the year. The workshops you'll have will help you learn how to do data collection. You'll learn how research design and methodology. You'll learn how to really project manage this, as well as when you're in country and you have this immersion field trip, you'll have the ability to really get hands-on experience with that particular topic and country and see it in context. So it's a fantastic opportunity. Currently, the 3 locations that we're looking at is one in the Middle East, probably Saudi Arabia, Nigeria, and India. And those will be the 3 areas and that our teams of MBA students will go to for their Global Health Challenge project. And these are supervised throughout, and you'll have a fantastic opportunity here to really understand and contextualize your learning as well. The other project that is equally or more important is your health consultancy project. And that'll be in term 3. We are working with a number of organizations to vet and prepare. So we will have consultancy projects. So this is really an opportunity for you to see what it's like to work for an organization as a consultant. You'll have your project, you'll have a brief, you'll meet with the organization, you'll consult with them throughout, and you will prepare actually the project and deliver it. And that will all be delivered towards the end of August, towards the end of term 3. And that will be part of your assessment, is the delivering of that project and also the presentation of that. And then you'll also have an opportunity to present that to the client. Now, depending on the project, depends on the size of the team. And so you might be working independently. You might be working in a small group as well with other MBA students in terms of that project. So again, a very, very exciting opportunity to put your skills to work and to gain that additional confidence and relevance. It can also serve, both of these assignments serve as great examples for employers of the quality and kind of work that you're able to undertake. So I've already talked a little bit about who this program is, and I just want to emphasize, this is not designed just for clinicians. It's not just designed for people with a health background. This is designed for people who are ambitious, who want to either pivot into health or are in health, but who want to really be exceptional leaders and make a difference. That being that change maker, really wanting to improve health and health outcomes for populations is really so important to us at the Global Business School for Health. Now, I just want to talk through the admissions. Of course, students often ask us lots of questions about their admissions. So you will need to submit your academic records. I know for some students, it'll be quite a while since they went to do a degree. And they may not have gotten a 2-1 in their degree, but they've now gone on and done some incredible work and have real relevant, experiences. So we'll take all of that into consideration. One of the things about having such a holistic approach to your admissions is that we look at everything. We look at the whole bundle. We don't just take one component to make a decision about an MBA student. So you do have to, if you're coming from a non-English speaking countries, you need to take an IELTS, and you'll need at least a 6.5. Work experience is really important for MBAs, and that work experience can come in lots of different forms. Ideally, you'd have 3 years of work experience, but you might be coming from a background where you've gotten work experience alongside your education. That's fine as well. We'll factor all that in. So that's where your CV will become really important to really articulate all the different ways in which you gain work experience. We do require you to take a GMAT or a GRE test. We're looking just for a well-balanced score. I think the average on those tests is about 550 currently. We do, in exceptional circumstances, waive that, but you would have to look on our website to understand how to do that. We'd expect to be able to evidence the same things that we'd see in a GMAT on your transcript and your CV. There is an interview, and I'll talk a little more about that in just a minute. And then, of course, a personal statement, which is really important in terms of articulating your intent for doing this program, and two references, one that should be academic if possible, and one from an employer. Now, again, I have students worry about, with COVID, how they might take the GMAT exam. You take the GMAT online, so you can register for it. There's also lots of opportunities to get practice exams. The reason we require a GMAT is because in an MBA, you're going to be expected to assimilate lots of information. You will be working through lots of cases. So those kind of analytical skills and quantitative skills, verbal skills are really going to be important. So we want to make sure that you're ready to do this program. So again, I wouldn't hesitate. The best way, students often ask me, should I take a course? Well, if you want to take a course, that's fine. But really the best way to prepare for your GMAT is take some practice tests, take lots of practice tests. And you can find GMAT practice tests and questions online. Many of them are free. And so it's just about preparing for it and taking the exam. As I said, we look at you as a whole package. We're not looking at you as just a test score. Here are some of the common interview questions that you could anticipate. Again, we get a lot of questions about the interview process. We will not set up your interview until you've submitted your application, and you will have to get your materials in, your transcript, your references. Once that's in, we will then be in a position to do your interview. And I look at it like most of you, if not all of you on the line today, have applied for a job. And when you apply for a job, of course, you have to send in your CV, you have to send in a cover letter, many of the same things that you do in an MBA. And then you have an interview. And so many of these questions are very common questions that you get an interview. Tell me about yourself. Why do you want to work here? Why do you want to do the MBA? What makes you stand out among other candidates? What can you contribute to our program? All of these are really important questions for us. And what we want you to do is really reflect. It's about us understanding your expectations and you understanding what the program offer and how we can work together to make sure you have an incredible and exceptional MBA experience. So the other thing, of course, that I often find, and rightly so, is cost. How much does it cost? It costs £45,000. That's the fee for a full-time. If you do it part-time, the fee is broke up over 2 years. At UCL, you'll pay in installments, so you pay by term, and there's 3 terms. So if you do it full-time, you'll pay £15,000 in term 1, $15,000 in term 2, and $15,000 in term 3. If you're a part-time student, you pay $7,500 in term 1, $7,500 in term 2, $7,000 in term 3, and again, the same amount on the second year. Living expenses in London can vary significantly, and it really gets down to you and what you want to do. Many students work alongside their education, and that's totally acceptable, and this program allows you to do that. When you come for your block delivery, it is in the afternoon. So if you wanted to work in the morning and then come in the afternoon, you can do that. So it allows you to be in work while you're also undertaking the MBA, whether or not you're doing it full-time or part-time. If you're doing it full-time, you probably want to work part-time. And if you're doing it part-time, you might want to work full-time if you can negotiate it with your employer. We have a number of scholarships and one that I'm extremely excited about. And it's one that we're going to be putting out a lot of information on in the coming week. It is the Roche UCL MBA Health Scholarship. It covers your complete tuition and also 20,000 living expenses. Also, Roche would like to offer an internship to the person who gets this scholarship, as well as mentoring. So it's a fantastic scholarship. We'll have up on our site in the next week the criteria and how to apply. Some of the things that we'll be looking for and the criteria is the applicant must be from a low income background, and we'll have on the website how you evidence that. They need to either be from a BAME background or identify as a female or both, and they must be from the UK. But this really is an exceptional scholarship and an opportunity for the right candidate. If you're an international student, you can apply as well for our MBA Health Future Impact Leader Scholarship. This is, again, a really great scholarship. And for international students, it brings the tuition actually down to the same amount that you'd be paying if you were doing a master's. It's up to £15,000, again, for exceptional students who are undertaking the MBA. You do have to apply to the MBA first to get the scholarship. If you're accepted into the MBA, you can get the award. All of these will go towards your tuition. You write an essay for this. It's, again, a great opportunity, a fantastic scholarship, and really covers a third of the cost of doing this MBA full time. We also have a Women Healthcare Leader Scholarship, which is up to $5,000. This is for female students who demonstrate leadership potential. We're really committed to this scholarship, not only because of the $5,000 you'll get towards your tuition, but also alongside this is a women's leadership development program. You'll get coaching and support. And this is really important given that there's a shortage of women in healthcare leadership roles. And last but not least, we also have a scholarship for people who either work or live in East London. Again, it's up to £5,000. And that's in really celebration of the fact that we're located on UCL's UCL East campus in East London. and and also an opportunity to really connect to the community. So in addition to those scholarships, there are also other scholarships and loans that you can get. If you're a UK student, you can always apply for a government loan. If you're a US student, you can apply and use a federal loan. There are also other scholarships for the students abroad. I always say to students to check with the British Council in their country. They're the Chevening, the Commonwealth Scholarship, Fulbright, Great, Master Bursaries. UCL has what they call a scholarship finder, so you can put in information there. We also have other events on scholarships and funding where we give a lot more information. So if you still feel after this, you need more information on ways that you would fund your MBA, please come to one of our funding and finance sessions. And again, as I said, career support, this is a great investment. It's an investment in yourself, in your future, and for us, it's an investment in healthcare. So I've mentioned the onboarding activities, but there'll also be lots of career events, opportunities to network, access to UCL careers. We also have a designated MBA career consultant who will work with you individually as well as a group throughout your experience with us. Your career and your career outcomes are very, very important to us on this program. I also just want to take a moment and remind you that actually it's not just about the MBA, it's about UCL. And UCL is an extraordinary place. It is a fantastic place to be a student. And that's why we have such committed alumni who are so willing to give back to support you because they've had life-changing experiences at UCL. And not all of those experiences take place in the classroom. They take place through extracurricular activities and student support. We have a wonderful student union, really active, really engaging. We have over 250 clubs and societies. I'm really looking forward to our MBA students creating a UCL MBA Health Society. We have volunteering opportunities. As I mentioned to you, we've got 5 NHS trusts associated with UCL. We have numerous other organizations. I often get people contacting me about how they can engage with us, how they can offer internships and experiences for our students. So, and we will make sure to be pushing those out to you as an MBA student at UCL's Global Business School for Health. We also realize that sometimes students can go through difficult periods. We've got student support and well-being team. They offer all sorts of counseling services and other advice. We also have a wonderful and engaging international student team that will also be available for our international students. So at no point in your time with us should you feel unsupported, isolated. We want to make sure that really this is the most transformational, best year of your life. And then for those of you who don't live in London or are not from the UK, life in London is incredible. It's just an amazing city. It has lots of tourist attractions, museums, galleries. Many of them are free. Festivals often going on. Wonderful greenery and parks, and lots of sporting events and facilities. So it's not just about being at UCL. It's also about being in London, one of the greatest cities in the world. And so it's not surprising that in the QS kind of student rankings of which city in the UK is best to live and study in, it's London. So that's really it for me. I'm really looking forward now to turning and using this final bit of our time together to answer your questions. I can see already that a few of you have posted questions. If you haven't posted a question, please do. We've got some other upcoming events. Next week, we have something on our digital health and entrepreneurship program. Also something on our global health management program with an analytics route. And then, as I mentioned to you, March 15th is our scholarships and funding information session. So if you'd like more information, please definitely attend that. Again, it's really a pleasure to present such an amazing program to you. And I'm going to now turn to your questions. So we have one from Thifa from Indonesia. And I've seen a few of the GBSH courses for master's degrees, and I'm very interested in joining one of them. Hence, I have not made my decision whether applying for the MBA Health or the Digital Health Entrepreneurship, considering the needs of the future of healthcare management in my country. Could you please enlighten me on the differences? Well, first of all, Thifa, I'd be more than happy, and I know our team and our MBA director would be happy to set up a one-on-one to have a chat with you, and talk to you about the MBA Health more directly. These are very different programs, so it really depends on what you're looking for. The MBA Health is really about giving you that wider kind of business and management skill, preparing you for leadership and senior roles within the health care and health management sector, but of course also instilling with you an understanding of change management and innovation. And I can assure you that if you want to make a difference in healthcare, that change management, kind of systems thinking that you'll get through the MBA are integral. The Digital Health and Entrepreneurship program is a very specific degree. It is also an excellent program, but it's focused more on students who want to go into health tech or med tech, who are looking to maybe have a startup or launch an idea that they have, a product idea. So they have a very different kind of remit for their project. Their project involves, actually taking a digital health idea, creating a business case and pitching that business case. They work on an individual research project. So very different. They don't have the kind of case study approach. They don't do the abroad experience, and they don't necessarily have the, their projects are much more on consultancy related and not so much on that business kind of startup space. So really both very good programs. I'm sure both of them could contribute in different ways. And so it's really understanding more your context, your background, and how that'll add. So you asked, does the MBA Health provide with healthcare innovation related materials and subjects? Yes. In the contemporary topics on healthcare, there'll be something quite specific in that kind of innovation space that will be part of that. Again, happy to have you reach out to the team and have a chat to see just and let them understand more specifically your needs so that they can make sure that they guide you to the right program. Hi, I'm emailed by GMAT GRE waiver. How long do I need to wait for results, please? So again, I don't know how long you've been waiting, but if you could send the team just a reminder note, I'm sure you'll get an answer soon around that. Usually it takes about 2 weeks for us to get back to you. If you're already in the process and you want to start your application, you can do that. And like I said, I'm sure we'll get back to you shortly with your GMAT GRE waiver. Okay, well, that's all the questions I seem to have. Is there any other questions? I'm going to give it 1 minute. Take some time. This is your opportunity. We're really here, by the way, to support you, to help you get the best application you can possibly get in, and understand the program, understand the expectations, and make the best decision for you. So if you want, as I mentioned, for our MBA Health, we do offer one-on-one sessions. All you need to do is email the admissions team and they'll get back to you with an answer. So I'll just continue to wait a few more seconds. I think I've got a fourth question. There you go. Any other courses focused on tech innovation, entrepreneurship under the global health context? I think all our programs, by the way, have an innovation angle, because innovation technology is really key to all the changes in healthcare. So it's something that runs through the fabric of the Global Business School for Health. If you want a very specific program, as I said, there's the digital health, but there's also biotech and pharmaceutical management. And again, there's a big innovation component for that. We also have on the global healthcare management program, we have a leadership stream, and it has a module on innovation. We have an analytics stream, and of course, analytics are at the heart of what's going on around technology. So honestly, I think any program that's offered in the Global Business School of Health, innovation will be covered in some respect. So what I would suggest is you just take a look, read through, check out the modules. But I can assure you, technological change and innovation will be covered in the MBA in various ways, because it's just so important to the next generation of leadership and management in healthcare. So now I have another question. Hi, I am actually very interested in the MBA Health. I am a pharmacist and I work in the pharmaceutical company. I actually took my first attempt at the GMAT with a 540. I am retaking my GMAT in May. Should I submit my application by then? The reason is that I'm not confident with my undergraduate grades. Again, I would suggest you set up a one-on-one. We can talk to you. A GMAT of a 540 is actually right there at the average. But I think the best way is to have a one-on-one with the MBA director. So if you email our admissions team, I'm sure that can be set up with the director of our MBA. By the way, her name is Professor Julie Davies, and she is really an exceptional individual. She comes to us with a wealth of experience, and so I think you'd really enjoy a conversation with her. Hello, thank you for such an informative talk. Are any sponsorship options available for NHS employees employed at UCLH? Well, I think you'd have to speak to your line manager. Of course, we're really keen to get anyone from the NHS onto our programs, either part-time, full-time. I would really suggest, and David Prober, who's the CEO at UCLH, is actually going to be teaching for us. We're very excited to have him as a visiting honorary professor in the Global Business School for Health. So I would suggest at a minimum, and again, you can set up a chat to talk to us. You can apply for the £15,000, so that brings that down. We also, as I mentioned, have other scholarships, and you can combine scholarships. We've got the Women's Scholarship, and we also have the East London Scholarship. So I think it's about, and I often say this to students, it's about putting together a package, trying to find as many routes. But I know the NHS has different ways in which they get funding. So I really encourage you to have a conversation with your line manager, see what's available. If you can combine a scholarship with support, that would be fantastic. And we'd love to have you on our program. Okay, any other questions? Well, look, you've been a fantastic audience. I've really enjoyed talking to you, having your questions. Again, please feel free to set up a one-on-one meeting with our MBA director. And any way that we can help you, we can support you. Our admissions team is there for you. They want to make sure that you get everything you need to really make a difference. Will this presented material be shared to us? Absolutely. we put the presentation on our website, so you can access that. If you can't find it, if you'd like it sent to you personally, we can arrange that as well. There are lots of opportunities. We have a YouTube channel, and it should be up there by the end of today, so that you can visit that and see that. But if you have any problems finding the YouTube channel, again, just write our admissions team. Okay? Again, thank you so much. Have a lovely afternoon, and take care. Bye.